Tuesday, we told you that the measles count in Arkansas has now reached 3 cases.
KTV has heard many of your questions regarding vaccinations, outbreaks, and community spread. I checked back in with infectious disease Dr. Robert Hopkins to get some of those answers. Take a look. Thanks so much for joining me here today. We know the measles has now reached 3 cases in Arkansas, counting 3 cases of the measles. And so this has sparked a lot of questions since we haven't seen an outbreak this large since 2018. Can you kind of talk a little bit about some of those vaccination requirements? I know we keep talking about the vaccine, but some of those age requirements, especially for infants.
Well, probably the most important thing to think about is our routine childhood vaccination recommendation is for infants between 12 and 15 months to get their first dose of MMR, which is measles, mumps, rubella vaccine. And then children should get a second dose, generally given between 4 and 6 years of age. Now, there are some special circumstances where we can give measles vaccine early or MMR vaccine early. So if you have a child that's going on an international trip, ideally, if they're between 6 months and a year old, they should get a dose of MMR vaccine before that international travel. Or if they're going to a location where there is a large outbreak, they should get that dose of vaccine. But because the vaccine's not as effective in children between 6 months and a year of age, they'd still need to get their routine vaccination at 1 year and then the second dose later on. That first dose really doesn't count because it's not as reliably effective.
And we keep hearing the year 1957. If you were born in the year 1957, there may be a little bit of a special circumstance there. What does that mean?
Well, in 1957 and before that, we had measles spreading throughout all of our communities in the United States. And so pretty much anybody that was born before that time had measles. And so they are immune if they survived that measles infection when they were young.
And between 1960 and 1970, there's talk that those people born within that time period may be a little bit less protected, or were vaccinated during that time period, maybe a little bit less protected. Could you speak on that? Is that true? And if so, how do they need to handle that?
Well, there were 2 different types of measles vaccine used in the early 60s. One was a live attenuated measles vaccine, just like our MMR vaccine that we use now. The other was a killed measles vaccine. That was given to some groups of people in the early 1960s, and unfortunately, it was not a very good vaccine. And so if you're somebody that was born in the late 50s, after 57, but before 1970, and you don't know what vaccines you've received, and you don't know that you've gotten an MMR vaccine since, then you may need a dose of MMR vaccine now to give you protection.
And, we're talking about children who are vaccinated at 6 months, also people, getting that third vaccine later in life. Is there any danger in getting multiple vaccines, or is it completely safe?
It is really very safe. This is a live attenuated vaccine. There are a couple of circumstances where we don't want to give it, such as pregnancy, because you don't want to give a live vaccine to someone when they're pregnant, because that could potentially be a harm for the fetus. We don't want to give the live attenuated MMR vaccine to somebody who's got severe immune suppression. So somebody that, for example, is going to have a kidney transplant or a bone marrow transplant. Those would not be good situations to give a live attenuated vaccine. But if you're somebody who has immune suppression, if you're somebody that's pregnant, talk to your healthcare professional about what you should do to protect yourself from measles.
Now, I do want to go back to something we talked about earlier with toddlers not being able to receive that second dose until they're 4 years old. So between the age of 1 and 4, is there any danger in them not being able to have both the doses there? And if so, what can parents do to make sure that they're still protected?
There is not a big danger, Kaylin. Remember, 1 dose of MMR vaccine is well over 90%, probably around 93% effective at protecting against measles. If we had a situation where we had a larger outbreak, then we might very well be talking about giving that second dose earlier. As long as it's given a month after that first dose, we still get that boost from 93% to 97% immunity by giving that second dose at an earlier age.
Now, switching gears a little bit from the vaccine, I know the Arkansas Department of Health has said that the 3 cases in Arkansas aren't necessarily linked to a community spread. What does that mean when they say community spread, and how can that occur?
Well, any disease that can be spread from person to person, you can catch it somewhere else and you can bring it home with you, or you can have it circulating within a group of people in a community, in Little Rock, in Pine Bluff, and whatever town in our state. We don't have any evidence of measles spreading locally within communities in Arkansas. All three of these cases, we believe, are imported from people being exposed outside of Arkansas. And so that is a lower risk situation. But if we don't respond effectively to it by tracing contacts, by vaccinating or providing protection to people who are not protected that may have had contact with those children, you could have community spread. So our goal is to prevent that happening.
Dr. Hopkins, thank you so much for joining me today and answering some of those biggest questions about measles. It's a huge topic right now, so I appreciate you sharing that with our viewers.
Happy to do it, Kaylin. Stay safe and stay healthy.
You as well.
Well, we do have a brand new article over on our website, ketv.com, how to find up-to-date information on measles in Arkansas. We have some of those questions. Here's some of those common questions, and we also have links to websites, the Arkansas Department of Health and CDC. On the Arkansas Department of Health's website, you can find Arkansas measles exposure locations, and those are within those cases that we told you about, those 3 cases of measles. On the CDC website, you can also find a map showing cases across the country. Of course, Texas seeing 250 plus cases. You'll see right here, Arkansas, 1 to 9 cases, and you can check some of those other cases. All of that is linked on that article on our website, katv.com. Isley, we'll send it over to you.